Health experts confirming it was in Europe a week before circulating to South Africa and other countries abroad. As a precaution, New York City reinstating its mask mandate, urging everyone to wear a mask regardless of vaccination status. Well, this variant is putting the world on edge, and so we got to bring in the man who tells us what we need to hear, not what we want to hear. BNC Chief Medical Editor, Dr. Corey Hébert. He sometimes tells us what we want to hear, if it's what we need to hear. Good morning to you, Dr. Hébert. Now, first of all, wondering if they're going to have any kind of travel bans in Europe now that, you know, it's come out that may have originated in Europe and not just in Africa. But anyway, we'll get into those politics in just a second. Here's what I want to know from you, Dr. Hébert. If it's Delta, if it's Alpha, if it's Omicron, right? Why does it matter if we don't understand the severity of Omicron right now? Because COVID is COVID. And if you're unvaccinated and you get COVID, there's an opportunity for you to get sick and die. So why does it matter what strain it is?
Okay, so the thing that matters is the fact that the vaccines will do a little different mindset on that virus based on how the virus has mutated. Okay, so let's be very clear here. When you had the alpha strain, okay, we made the vaccines to the spike proteins on the alpha strain. As it starts to mutate, then our vaccines that are against the spike proteins on Delta, then they weren't as good because we made the vaccine against the actual alpha. Now, as we go up against that Greek alphabet, now we're at Omicron. Then the spike proteins now have mutated even more. So we made the vaccine against the alpha, which means that the Omicron has mutated a little bit more. So the vaccines may not be as effective. Now, let me be very clear about this, and I'm glad you said it, that coronavirus is coronavirus. So the vaccines will be effective against any coronavirus, okay? Any coronavirus that's SARS-CoV-2, it will be effective. How effective they will be is the question. Now, we just had some data coming out of Israel last night that said that their vaccination rates are very, very high and that they have been able to isolate and see that their vaccines, the Moderna, the Pfizer, they are holding up against the Omicron strain. How well, we still have to see, but we know that they're holding up pretty well. And we had a lot of folks out here saying that the vaccine it's impossible for the vaccine to work, and that is 1,000% untrue. So I don't want people not getting vaccinated now because they think that it doesn't work, because it does work. Just how well it works is up for debate.
And this is the reason why they're pushing boosters a little bit more, I guess, urgently, in a sense. Go ahead and get those boosters right away instead of saying, oh, you can wait in 6 months or whatever, and recommend getting the boosters. They're encouraging you now to get those boosters.
Sure, absolutely. And the reason why is because just like with, I just want to, in no way is the flu similar to coronavirus. And except this one way, I want people to realize this. Every year, we have a new flu shot. A new flu vaccine every year, because we look at the surveillance from the places that get it first, meaning get the flu first, then we get that data and we go to the lab and we make the vaccine based on what we see in other continents, okay? So we have a different vaccine every year to optimize. So if we have to make another vaccine that is more optimal against Omicron, then we can do that. That's why we use the mRNA technology. That's very easy to be done. But we don't think that that's going to be necessary at this point. But if this keeps going, because, you know, the whole vaccine apartheid issue is that in the United States, we have 3 shots. People have 3 doses in them, right? In Africa, some places don't have 1 shot. So this is where a lot of places are getting these variants, because the vaccine will work, but the virus will mutate only in places where they can have the infection rates very high. And that is other places. And I'm glad you said this earlier, too. They're trying to put this on Africa. Don't put this on Africa. We ain't got time for you putting it on Africa, because just like the Spanish flu didn't start in Spain. The Spanish flu started in another country, and Spain was the first country to tell the truth. All right, this virus started in we don't know where it started, but we know it didn't start in South Africa because it was in other Western countries long before it was in South Africa. But South Africa has a very innovative and robust typing service, so that what they can do is type the virus and see what it is. So Africa basically saved the day. We saved the day.
Right, because they spoke up. Right, that's what we do. Well, we're the originators of everything, including man. It doesn't matter where it originated. We just got to take care of it. We got to be effective and defeat it, no matter where it is.
Exactly.
I do have a couple more questions for you. Hopefully, you got a little bit more time.
Sure.
I want to ask you this because we're talking about the vaccinated, but I'm more concerned about the unvaccinated still. So, like the Alpha, we talk about the Delta could be a little bit more severe. If they get the Omicron, the unvaccinated, do we know what kind of effect that could have? Could their symptoms be more severe? Could the death rate go up? That's what I'm trying to ask you here.
Well, this is the thing. There are a couple of reasons why we need to get vaccinated, okay? And we have seen the cases in other countries. We've seen the cases, and we have seen that they're not that severe, okay? They're not that severe as far as that whole concept of death, okay? But what we cannot gloss over the concept of long COVID, which means you get this and maybe you don't get a lot of symptoms, but long down the road, you will have severe neurologic problems. That's one thing. The second thing is that we know that this spreads very rapidly, more rapidly than the Alpha, but maybe similar to the Delta, maybe even a little bit more, which means if it spreads that rapidly and people get sick, they end up, if more people get sick, the more people will be in the hospital. More people in the hospital, more people in intensive care. And what that means is that it burdens the system, and now we're back down to trying to flatten the curve again.
Right.
You see what I'm saying? It probably won't make more people die, but getting a lot of people sick at one time, that is the problem. And that's why we got to get these vaccines so that we can, whether you die or not, we don't want you to die, but we just don't want you to even get really, really sick. And because that will burden the system, and then that will cause our system to implode.
Mr. Bedside Manner, because your health matters. The man that keeps you real all the time, doesn't tell you what you need to hear, or what you want to hear, but what you need to hear. Dr. Corey Hébert hanging out with us here on Start Your Day. Thanks so much, man. We'll check back in with you a little bit later on this week.